Hey everyone, welcome. Today I'm Dr. Maggie Yu. I'm an integrative functional medicine physician that focuses my practice on healing autoimmune disease naturally. And we have an 8-week online program for healing autoimmune disease naturally. And today we have here with us our special guest, Mikki. And Mikki is a graduate of our program. She graduated about a month ago. So what I would love to do is, for those of you who are just joining the broadcast right now, if you can go ahead and just give me an idea of where you're watching from, that'd be super helpful. So we know the demographics of who we're talking to. That'd be great. And right now, it's also a really great time to share the broadcast. If there's anyone with autoimmune disease, rheumatoid arthritis, dealing with chronic pain, and you want them to be watching this later, go ahead and tag their name in the section below now, in the comment section, so they can watch it now or they can watch it later. That would be great. And for those of you, and if you can give Mikki a big thumbs up for braving this to share her journey with us, that would be awesome. So giving us a thumbs up or a heart would be really awesome right now. And what I want to do is I want to introduce Mikki. This is Mikki for totes. And Mikki is, she said, can you hear me?
I can hear you.
They said they can't hear me. Can you guys hear me? Can't see or hear. Jane. Can everybody hear me? Anyone hear me? I just want to make sure. No one can hear. Can they hear me?
Oh, no.
You can hear me, so they can hear me.
Yeah, I can hear you. It says can't see, can't hear.
Let me see. You're loud and clear. Perfect. All right, we're going to go back to it. All right, so people don't have their volume on. Not us. All right. So I want to introduce, guys, all of you, please let me know where you're watching from. That would be wonderful. It just gives us a really good idea. Share it right now and give us Mikki a thumbs up. What I want to do is introduce Mikki. She is a busy mom and executive who's been dealing with RA and ulcerative colitis for a long time. And we're going to be focusing a lot of our interview today about pain, how to deal with pain and autoimmune disease. And we're going to use Mikki's journey in the last 8-12 weeks as an example of what can be done for pain. So without further ado, I want Mikki to go ahead and introduce herself to all of you.
So hi, everybody. Thanks for joining. And so my name's Mikki, as Dr. Maggie said. And so I am 47 and have been dealing with rheumatoid arthritis and ulcerative colitis. I was diagnosed with RA about a week after I turned 30. So for about 17 years now, and ulcerative colitis about 10 years. Was diagnosed with that shortly after my son was born. I have, tried numerous things, and none have seemed to be helpful, or if they were, it was a very short period of time and things would just come back with me not understanding what I did, why it happened again. So I've been dealing with the pain for quite some time.
So let's go over that. Like if you were, let's say, before you joined the program, what level of pain, if there's a scale of 0 to 10, 10 being the worst pain worst pain people can imagine and 0 is nothing, what number was your day-to-day level of pain in dealing with your RA?
So I was at a 20. I remember calling you, sitting in the parking lot in tears.
I remember that call.
Yeah, I mean, I had just felt like I had tried everything. The only reason I found you is because I was still online searching for other things to try. I mean, and I've tried it all. I mean, I've tried embryonic stem cell. I've tried that. I'm sorry.
So let's go through the list of things that you've tried to deal with the pain of just the pain alone of dealing with RA. Let's go through that list. What have you tried? Because this is a very similar journey to many people that have had in dealing with autoimmune disease and their pain. So let's go through that list so people know that you're real and these are real things that they've been trying themselves too, and let them know what the outcomes of each of those things were.
It'd probably take less time if I told you what I haven't tried, but we'll go ahead and for the sake of letting everybody know what I have tried, I have tried every elimination diet that you can think of. I have tried embryonic stem cell treatment, and which for those people who aren't familiar with that, it is extremely expensive.
One joint, it's about $10,000 to do treatment.
$10,000 for me to do it. And not only that, I'm on the East Coast and it was on the West Coast. So I had to get to California. I had to pay for flights. I had to pay for, hotels and meals and all of that kind of stuff. And so I've done that. I've done biomagnetism. I've done, basic things like acupuncture. I've done herbal, Chinese herbal remedies. I've made concoctions. I've done mushroom drinks, you name it. And if it's out there, I have tried it. I'm just wondering if there's anything I haven't tried. And so by the time I called you again, I was at such a pain level. I could barely move my wrist, which by the way, hey everybody.
No, let's back up here. I remember like week 1, you were on the mastermind call with us on video, just like this. And you were wearing the braces and you're like, Maggie, what can I do for my pain?
Yes, I was like, please help me. I don't know what I'm going to do. And I was wearing these big, awkward wrist brace. I had to sleep with them. It was hard for me to do my hair, my makeup. I mean, it was just excruciating. I was using a cane to walk around because I had surgery on my knee. And of course, the rheumatoid arthritis didn't help that heal. And I mean, I was at the point I was desperate. And I remember just bawling on the phone with you, saying, I need to do something different. And all of a sudden, you started asking me about, my menstrual cycles, things that, and I'm like, oh my gosh, yes. How did you know that that's going on? And all of these
patterns.
Things. Yes. Just started like, nobody's ever asked me those questions before. And I was like, yes, all of those things were happening. And it just made sense. And I was like, I know I have spent thousands of dollars, thousands. I just knew I had to give it a try.
Thousands. It's not just thousands. Yeah.
Oh, easy.
Even 100.
Oh yeah. Yeah. Easy. I'm in double digits, And so not to mention the time and research and just trying to desperately find something. And so I just was like, I'm going to go for it. And thank you. Thank you for having this program.
Okay, so let's do this. Let's talk about, for those of you that are watching this right now, what have you guys tried for the pain and what are the results of it in autoimmune disease so that we can actually, it's a community that we're in and it's great for us to share. What have you tried? Did it work? Did it not work? And I want to actually put some of these patterns together for you based on what Mikki has experienced as an illustrative case. So for example, let's talk about that. Week 1, you were in your braces. What do you feel like? Why after spending, 20, 30, whatever the number of thousands of dollars is that's in the double digit, you didn't get the outcome? So to me, that's extremely expensive. And it's also occupied a huge part of your life. And so for me, my question for you is, in our 8-week online program, first of all, what do you feel were some of the major linchpins that really helped to get this pain level to where it is today? Before we begin, what level is your pain on a regular basis today? You say you started out at 20 over 20.
Yeah, I'm at maybe like a 4 or 5. And the reason I'm at that is, to be honest with you, I'm not as disciplined as I should be, right? I know what my triggers are now because of the food mapping that we've done. So that's part of the question, answer. And sometimes I still choose to eat that sandwich, and I now. Right. But I know that this is what's going to happen. Right. And so it's no longer a guessing game of like, okay, is it the weather? Did I eat something strange? What is causing me to be in so much pain this morning? So
what you're telling me is food mapping was a huge linchpin to dealing with the pain of autoimmune disease. Point number 1. Okay.
Absolutely.
So why did elimination diet not work? Because everyone thinks that doing all the things with food means these broad brushstrokes of eliminating big groups of stuff. That didn't work for you. Why is food mapping, why was it a linchpin for you? Why is it different?
Well, for me, and again, I can only speak for myself, it may work for other people, but for me, I'm a foodie, right? And so going on these elimination diets that were so strict, and I could not even enjoy life, and I didn't want to go out to eat with my friends. I was getting depressed because, basically all I could eat was green vegetables with, oil and vinegar on top of it, maybe some salt and pepper, right? And so for me, knowing that I could still eat great, fabulous, wonderful food, that to me was a motivator. Like I was able to still continue and stick with it, and quite frankly, I had to learn to eat more. And that was probably the most. And not only that, did I eat more? I've actually now lost 7 pounds. And so, and I'm eating more.
And I know. That's the thing is, it's like, because it's based on your own data, girlfriend.
Right. I love it. And I love to eat. So I'm so excited.
You don't but that was actually eliminate 50,000 things from the planet.
Right. And so for me, that has been a big thing for me. But I'll tell you, that was a challenge, right? Because I had to learn that, because eating was such a miserable experience for me, because I was eliminating everything, I just learned how to just not eat. All right. And so I had to retrain myself. And I remember the conversations I would have about eating breakfast. And Frankie saying, Mikki,
because this is linchpin number 2, Mikki.
Yes, blood sugar.
Linchpin number 2 for pain control, blood sugar.
Right, which I'd never heard before, ever. And I've done hundreds of hours of research on autoimmune and things that I could try to do, and never did that once come up. And sure enough, as soon as I started keeping it level, keeping it where I, was eating the snacks, it's amazing. It's absolutely amazing.
Let me ask you, how quickly did it take for you to notice there was an improvement in the pain? How quickly did it take you to get out of the braces?
Was about like 10 days. I went through horrible gluten withdrawals, right? And which I didn't know that was even possible, right? But I did. I went through horrible gluten withdrawals. I didn't know what was going on, to be honest with you. And I remember having that call. I was emotional. And I was like, I was meant to eat gluten,
You were tearful.
I was tearful.
I was like, swim your river, girlfriend.
Yes, you did. And I love that. You were like, you know what? Suck it up. Keep going.
You're going through gluten withdrawal. But I mean, Mikki, that's the difference with having a guide. Because most people, if you had gone through that alone without me telling you exactly, and Frankie supporting you through that process of what to expect and what was to happen, and the troubleshooting live that happens in the program, you wouldn't have known that was gluten withdrawal, and you would never have gotten off some of these foods that were a major trigger. Now that you know.
Right. And the other fabulous thing, and I don't know if we'll talk about it, but is the group setting. Oh my gosh. I mean, the people that were in my 8-week, and people kind of roll on and roll off, but wow. I mean, I feel so lucky to have had the people that were in my group, because for once I felt like there were people who understood what it was that I was going through and that could relate, and things that I was learning from other people that, they brand names of things, even like the CBD oil, talking to Rose and, saying, hope she doesn't mind I name dropped Rose. If you do, I'm sorry. I don't know if she's on here, but anyway, yeah. So, learning about, okay, what are the CBD oils that she's tried, because I've tried them too. And, so just that knowledge sharing was so invaluable.
And that's the thing is, so many people right now, how many of you are in the research mode? You're Google kings and queens. If if you're in research mode, you've been Googling the heck out of everything. Say me too. I'm a Google. I'm still doing the Mr. Google research thing. The thing is, what I loved about it is, there were so many opportunities to talk about these alternative therapies. For example, we have bonus material that's on low-dose naltrexone. We have a bonus section now for discussing medical use of CBD. Which, let's talk about those two things in your case, and how big of a linchpin were they in your autoimmune disease? Let's talk about that.
Huge. So, I'll start with the LDN, right? So, with my ulcerative, I'm sorry, And so, as I mentioned, I think earlier, I've had ulcerative colitis for probably 10 years, severe, to the point where, I've done the I think it was Remicade and the injections and the infusions and the Humira. I've done it. I'm telling you, I've done it all. And so, they wanted to remove my colon. And so this wasn't a, small bout of ulcerative colitis. This was serious. And so, thank God, I said no, and, suffered for a very long time because the medications just weren't working. Right. And now I just had my last colonoscopy on Valentine's Day. That was my romantic gift to myself. and all of a sudden I'm an inactive, flare. And so, whereas the one before that, not so much. And the one before that, not so much. And I had to beg my GI doctor to get on LDN. And at the end of the day, he still didn't prescribe it until after this last colonoscopy that came back where I'm completely inactive. And he looked at me and was like, oh, I guess it's working. I had to go to a pain doctor to get the LDN. And I've never heard any other doctor talk about LDN but you from an autoimmune perspective. I mean, it's crazy. And, I have it back. So, I'm showing people my hands. Like, if you think my RA is not serious, like you can see the deformity in my hands. I have it, it's real. Medication just doesn't work for me. And believe me, I've tried it. I've been on, azolfidine. I've been on Plaquenil, like you name it, prednisone. I've been on all of it, and it just doesn't work for me.
You know what I love? I think a really important skill that we teach in the programs, we teach people how to have, first of all, educating you on to have an educated conversation, to be on an equal plane with the providers you're working with is really key, number one. Number two is how to invite collaboration from those doctors so you can assemble the A team for you. So let's talk about how did our working in our program for the 8 weeks, how did that train you to have a conversation with your GI doc about this? How did this change your conversations?
Well, because I knew what my lab results needed to be. I was able to talk, they weren't able to talk over my head anymore, right? Because I had the knowledge, even though it's a lot of information and I had the paper, in front of me and I'm looking down and I'm reading it. He knew I was armed with the information, right? He knew I was armed with the information. And I remember him even saying to me, "Oh, I see you're going to be one of those difficult patients." Quote. And I was like, "Oh, you mean educated?" And then he just kind of chuckled. And I love him, I love him. And he just kind of laughed, and I was like, "Will you please write me the prescription now?" And he was like, "Yes, I'll write you the prescription." I was like, "Thank you." So, so that's, one thing, you're just armed with the information, which is so invaluable because there's so, I can only speak for myself, right? But there seems to be so much conflicting information that for me, I was confused. I no longer knew what to believe. I didn't know who to trust. I didn't know, do I give this one more try? When I first saw in your little video, that kind of is an introductory video.
The online training at Healing Autoimmune Disease Naturally. Yeah. Yeah.
I was like, yeah, right. Here we go again. Right. And I have to be honest, that was because I've tried so many things, that when you hear one more thing, you just in your mind, you're like, this isn't going to work because nothing else has ever worked. But again, I was so desperate that I just said, I'm going to call this woman. I'm going to give her my time and we'll see what happens. And lo and behold, thank God I did.
I think a lot of people will say that they've tried everything. And to be honest, when you actually look back at all the things that you tried, even though it's a long list, none of it put it all together.
And, quite frankly, it's not everything, right? Because I hadn't done the food mapping testing before, right? No one ever tested me for that. I get blood work drawn all the time. I'm constantly at the doctor, right? Or was, and no one told me that I had a thyroid issue. They weren't even running the right test to know
in the program.
And that's what I learned here. My vitamin D was extremely low. My B12 was off. My iron was horrible. So all of these things, and I get tested for them, and yet nobody told me, because I go back and I look at my labs and I'm like, it's right here. Yeah. Why is it that 3 years ago it's the same and nobody told me to start taking vitamin D and start taking B12 and do all these things?
Because they are not operating from functional ranges of labs, and you learned in this program what functional ranges meant.
Yeah.
And now you can have an intelligent conversation about this, and now you can do this yourself. Fix this yourself.
Right. But it's so frustrating and exhausting and mentally draining and depressing. I remember, nights, and I think I shared this with the group, just kind of laying there thinking, I can't keep doing this. This is not quality of life. I don't want to get emotional, right? But I can't go on like this.
Something has put you on the calls when we had our live masterminds. There were times when you were super frustrated because, of all that you have gone through in the past. And sometimes when you thought things were getting worse, what did I tell you?
Yeah, you were just like, hang in there. It's getting better.
No, it's the breakdown before the breakthrough.
Right. Yeah.
And to have a guide and to be able to be in a position to be able to tell you that with confidence and certainty, knowing that you're just literally 2 millimeters away from that other side.
Right.
I love doing that.
Yeah. Yeah. And the difference is I believed you, right? Whereas before, one, I didn't have anybody telling me that, hang in there. I didn't have a group of people saying, hang tight. I've been there. Hang tight. You're really about to make this happen. And then all of a sudden I remember saying, I woke up one morning and it was like, oh my God, what? I mean, I think I was already in the bathroom brushing my teeth before I realized, like, oh my God, it didn't hurt to squeeze a tube of toothpaste. Like, oh my gosh, what just happened? So yeah. But, also learning about like the CBD oil. I'm still not up to where I need to be because the taste is, they all have different tastes, right? And it's a different feel. But I use the cream, here it is right here. I carry it with me wherever I go.
Yeah. How much of a game changer is that as a topical treatment for the pain?
Man. I mean, it's fabulous and it works almost immediately. I mean, I love it. It doesn't smell the best, but hey, it keeps people away I don't want to talk to. So yeah, it's got a nice little smell to it, but I travel with it everywhere I go.
But I think that's where it's like there's so much confusion even about medicinal use of CBD and how it can be useful in autoimmune disease and the various ways that it is. I love being able to educate people on that. And then to have people in our group setting be able to contribute their experience with it was so invaluable, Mikki.
Oh, yes, absolutely. No doubt. And then the alum group, right? So you have the alumni group. And so we're able to still continue conversations and people are asking questions and, hey, what are you doing now? And so even though I had horrible, separation anxiety from you.
You're about a month out. You just graduated a month ago. So I want people to see what it's like. Like, is this sustainable? You're a month out. So
it's sustainable. Mm-hmm. Yeah.
But are you having, I mean, you mentioned separation and anxiety.
I know.
But can I tell you something though? I mean, you shared with me right before this call, the interview started, is that you are currently now in the driver's seat for the first time in your health, working collaboratively with a functional medicine doctor that we taught you the skills of how to choose.
Yes. Yes.
And you're also sitting at the table as an equal with your functional medicine doctor, reviewing your labs, asking for labs. And you're literally the pilot on your own plane now for the first time.
Oh, yeah. I remember we had to retest because I'd been on the thyroid medication for about 4 weeks. And, you had said this as well, right? Be sure you retest in 4 weeks so that you can see where you were. And my levels weren't up enough. And so she only ordered the thyroid test. And I was like, wait a minute. I need all these other tests too, because I want to get blood drawn. I am not a needle fan. I want to make sure I get everything done. I want to see where I'm in my vitamin B12 and my iron and my permethrin and all these things. And she just started chuckling. She's like, okay, let me rewrite the lab. But had I not had that information, I wouldn't have had now a couple of opportunities to see, okay, well, how far am I coming and how am I progressing and what do I need to change and alter? Because it's a continuous, kind of learning skill, right? And so, but you have the foundation of what you need to do. And so, it's invaluable.
Well, you talked about spending like 20, 30 plus thousands of dollars and not getting the outcome. Was the investment in this program worth the outcome that you're getting and continuing to get?
Oh, yes. I mean, I just wish I would have known sooner, right? Maybe some of this deformity wouldn't be there. And, I'm coming to love my new hands, but it was absolutely worth it. I would do it again, and I tell everybody I know that has any kind of issue, I'm like, you've got to call this woman. I mean, complete strangers, I'm like, call her. I'm telling you, just call her, because I just feel that passionate about it. And I just wish that I had known somebody that had known somebody like you, that would have told me this, even 2 years ago. Right. Because I feel like it was rapidly getting worse, over the last like 18 months. And I was desperate, I was literally desperate. So yeah, yes, worth the investment. Not just money. It's not just money. It's the time and the commitment to yourself. And we're all busy, right? We're all busy. And believe me, I'm really busy and I travel a lot. And yet the way that the program is structured, it didn't matter if I was here or sitting in Honduras or wherever, Poland, it didn't matter. I was on the calls. I made the commitment and the dedication to stay on the calls, to learn from the group, read the material. You have to dedicate yourself, because just listening to the information will make the calls then and our sessions so much more valuable because you've got basics answered already. And now it's about really diving into detail about what it means personally to you. But you have to have the information before you can get more specific to you. And that's what the mastermind calls are for. So for me to say, okay, this is what I've learned. This is how that's translating for me. And okay, and then we had the one-on-one conversation. And yes, there was a group setting, but it was such still an intimate, private, this is for you, Mikki. And hopefully other people could learn from because I learned every time you talk to somebody about their own personal situation.
They were all your teachers, Mikki, not just me.
Oh, yes. No doubt. No doubt. You were Yoda. Remember all the Yodas? Do not try. Or whatever it was.
Try. Do or not do.
Yes.
There are a lot of Yoda imitators.
I'm trying to go gluten-free. You're like, do not try.
No, do not do. There is no try.
Yes, that's it. And so you're also learning in a very fun environment, as you can see.
Definitely.
Yes.
And Mikki, a lot of people, like, the reason I love to interview you as a real live case study for everybody in here. And, please, guys, give Mikki a thumbs up and give her a heart or a wow face right now. This takes a lot of bravery to come on here. And if you have anybody who needs to watch this, please post their name in the comment section. They can come back and watch it later. That'd be great. And share it to any of your groups that you're in, the autoimmune disease groups, so that everybody can benefit from this conversation. But a lot of people, Mikki, is that they don't, I like to pull people to actually do a live interview here. These are not scripted interviews, and you're obviously a real person. But a lot of people, even when you're talking about the results and outcomes you have, they think it's fake. They think you're a paid actress.
Oh, wow, I wish. No, not at all. No, not even close. Yeah. No, I'm speaking from my heart, and this wasn't easy for me. I'm outgoing, but I'm freaking out, having to do this. But at the same time, I just feel like this has been a gift to me, right? That I gave to myself that I have to share. And again, as I said before, I just wish that I had known somebody or who had gone through the program that would have shared it or saw your video earlier in this whole process. But that didn't happen. And that maybe was for a reason, right? Because sometimes you have to get to a point where you just can't take no more until you do something different. And for me, that's what happened, right? My pain level was so high that I was like, I have to do something again, different to try. And so, yeah, no, I'm not a paid actress. This is real. And I'm speaking from the heart. I have no reason. There's no incentive here for me to tell anybody any lie. And in fact, if anybody wants to IM me, you can IM me.
Oh, I will. Invited a hailstorm, woman.
No, but I mean that truly, because when I tell you, I'm in different autoimmune groups and I've gotten some, I see people's messages that are so desperate. I don't know these people. Madam, and I just am listen, you've got to reach out to this woman. I know this is a strange, reach out. I'm not stalking, but I saw your post and you've got to call this woman. You've got to listen to this video. And that may make me seem weird or strange or odd, but I just feel like I have this gift of knowledge that I have to share.
And Mikki, here's the thing: is it's not so anybody. There's a lot of you that are watching right now who are currently who are graduates or program. If you are, say that you're a graduate. Those of you, some of you that are watching that are currently in the program, can you just kind of say what your status is and let people know what your experience has been in the program, and please give your honest feedback, and just let people know that what your experience is, so that people know that it's not like one isolated case. These are all the people that are in our program, graduates and current people that are in our program. Now, one thing that I wanted to ask was, in your experience of watching the people in the program while you were there, are you someone that is like a superstar that has an amazing outcome that's above and beyond what anyone else has? And I'm only putting superstars on interviews. Or what were the typical kinds of outcomes that you were witnessing? How were you compared to the outcomes that other people were experiencing?
Oh my gosh, I feel like my outcome is probably the minimum of it, So I am definitely not the superstar. Now, for my own personal, right, I feel like I'm the superstar, right? Like, thank you. But I mean, the things that I saw, the evolution of people and the transformation of people that were bedridden and we're now, it may seem small. I do. I do. And the joy that she had just being able to walk around Target. And I can relate to that.
For a year, and now she's she's dancing, by the way, Mikki.
Yes. I know, or Rose doing squats and I can relate to that because believe me, I've been in so much pain before that when I go to Target, I'm in the cart, and my kids are sitting on my lap thinking it's a joyride and I just want to be able to walk, but it's so painful that I can't, or not being able to turn the steering wheel, and I mean, it's that painful. And so, yeah, I mean, just the transformations were incredible. And I remember in the beginning thinking, that's never going to be me, right? Because then, you try so hard. So you go from, that's never going to be me to, why can't that be me to, holy crap, that's me. Like people are looking at me like I'm not what they're looking up to, right? And I'm like, oh my gosh, I'm that girl, And so I just truly, no matter what, grateful for you and Frankie and for your whole team. Everybody is just fabulous and very responsive. And, there's no words to say thank you for getting your life back. There just are none, there just aren't. I'll get emotional. I don't want to cry. But yeah, there just are no words. And thank you is not enough, but that's all I can think to say is thank you.
Mikki, thank you for coming on with us. I mean, I know this is outside your zone of comfort. But your honesty, and your story, the whole point of this is to actually tell people like sharing your journey actually gives so many people hope. But it's for me, it's interesting. I say hope is great for breakfast, but don't end supper with it. Because here's the thing is, it isn't just about hope. It's actually about real proof, a real plan of certainty of how you get the real outcome.
Right.
And that's the difference. When you said you had tried everything, was that you didn't have clarity, certainty, and a clear plan of getting the outcome. You were haphazardly doing a variety of different things that you researched that you thought would be helpful.
Right.
Where a lot of people are at.
Yes. I know the cause and effect now. Mm-hmm. I know the cause and effect. I know what to look for. I know what labs to do. I can feel now in my body like, okay, I forgot my vitamin D, right? I can tell now when I'm like, okay, it's not feeling right. Or my blood sugar, it feels like I better eat. In the beginning, I literally had to start setting timers because I conditioned myself so much not to eat because it was a miserable experience. I had to recondition myself to eat and then lose weight. Life is great.
It's so amazing to be like adding more foods, eating more regularly, feeling like satiated, and actually losing weight.
Yes, doesn't get better at that.
How does that happen? Thank you, Frankie. Frankie's our
program. That's how it happened. And Frankie's guidance. That's how it happened.
Frankie's our nutritionist. For those of you who've experienced working with Frankie in our program, please on the bottom tell people what your experience has been. And for you, that was a huge linchpin for you working with Frankie to break that blood sugar cycle, right?
Oh, yes. Mm-hmm. And the patience, right? Because again, if somebody's looking for an easy fix, I would say this isn't your solution. I'll be honest, right? Again, you asked me for my honest opinion, right? This isn't your solution. It's not easy. And it's not easy because I think culturally we're so attached to food, and in my case, food's the issue, right? So other people have other battles, but for me, that's my demon, right? So it's not easy. It's hard. Every day is still a challenge, but yet I've already created patterns. I know where to go. I know what to ask for. I found my restaurants where they see me coming and they know it's the rice crackers, not the bread, and that's okay, before they.
I think it's funny that you say it's hard. And you know what? I think it's hard living with 20 out of 10 level of pain.
Yes.
That's ridiculous. And sitting in tears in the parking lot talking to someone because that's a level of pain and that's a level of like suffering that you were going through. I think that's impossible to live with. Compare now with this clear plan of what you were.
Yes.
I think it's a cakewalk.
You're so right. And you're bringing up a really good point, because the other, I think, what did you say, linchpin, or the other the fabulous thing about this program is your mindset.
Mindset work, yeah.
And being able to, just what you did just now, right? To
reframe
what you're thinking, right? And you're absolutely right. And the end of the day, it is so much easier to sit down and say, I want rice crackers than it is to pick up the cane, right? Or have to get into the wheelchair so that I could go around Target, or sit on the sidelines while my kids walk around Hershey Park and I can't. Why? Because there's no wheelchairs available that day. And so I've got to sit at the gate and, let them go off with their friends and their parents. And I don't get to participate in that. That's hard.
Yes. No more of that bullshit.
You're so right. Yeah. And then that's not me. That's not my life anymore.
That's suffering. That's
not my life. Yeah, that's hard. You're so right.
Change in weeks.
Yes, agree. And so the mind shift and just the mind work that we did, that's another invaluable piece.
And you don't know this, Mikki, because there's something that we've just added this month. Is we've added also, besides, I do a lot of mindset work with you guys, but what we decided to also do is add a mindset coach to our program. And yes, we added the mindset coach, Jackie, to our program, and she is fantastic. And feedback from clients in the program has just been huge, because this is a whole reframe process that you need to learn for yourself how to do. Right. And so, you don't need me to sit here and tell you to reframe this. You're going to learn how to do this yourself for the rest of your life.
You're going to come do an alumni group session?
Jackie actually mentioned she wanted to visit the alumni group.
Yes, Jackie, please come.
Okay, Jackie, we're going to tell you.
Is she on this call?
All right. Well, thank you. What I want to do is, for those of you who want to learn more, I hope you guys learned a lot about how to deal with pain, like real solutions for pain. This isn't just about like, hey, this is the dose of LDN you should be on. This is the exact brand of CBD oil. It's not that. This is about a whole solution, guys. Please stop looking for one Band-Aid to your pain or chronic issues with autoimmune disease. You've got to understand this is something that requires a whole circle approach that addresses everything, every piece of it, with your own data, and a process of integrating that to teach you how to be the pilot of this whole ship. And so for me, this is really a plane, not ship. And so for me, this is what we do. It's huge. It's a huge program. It's ambitious, but the outcomes are ginormous. And the commitment level is huge from the clients that are in here. So thank you. I want you to learn more about the program. Go to healingautoimmunediseasenaturally.com. You can click the links that have been posted for that to watch the online training about what it really is the paradigm shift that we're doing here. Nobody on the planet is doing what we're doing in this program. Nobody. And the way that we're doing it. And that's why we get these outcomes that nobody else is getting. So I love it. So thank you for being a real life example to everyone of what can happen when you go all in, when you get decisive, when you commit, when you get resourceful, when you're coachable. Yeah. This is what happens.
Yeah, totally agree.
Thank you, everyone. And thank you for joining us, and give her some love and share this video, guys. The videos have been really shared, and people have been sharing into their groups. These videos have been reaching, by day 2 or 3, over 2,000 views. So, yeah. So please feel free to share, and as many people need to hear this message. Go for it. And it's been great. And thank you for all your wonderful comments and support during this broadcast. Thank you.
Thanks. Bye, everybody.
Bye.
Bye.